So the first presentation for session 2 will be on the community perspective on the prevention of neural tube defect, and this will be presented by Sister Sylvia Massawe. Sister Sylvia is a critical care nurse and a neurosurgical nursing program coordinator at Muhimbili Orthopedics Institute in Dar es Salaam, Tanzania. She had a key role in training and professional development in her home countries. She has been involved in training of around 642 nurses across Tanzania and Zanzibar, collaborating with the Ministry of Health, and has helped establishing training networks in 5 regional hospitals in her home countries. In addition, she has active participations in international neurosurgical forums, including the WFNS Asian Congress and the Global Nursing Committee, and she has served as a board member on the Asian Congress of Neurosurgical Nurses. And I will kindly invite Sister Sylvia to start her presentation.
Okay, thank you so much, Dr. Ebenezer, for such wonderful introduction. Before all, I would like to convey my gratitude to first presenters for such a wonderful presentation. Again, I'd like to thank the organizing committee for granting me such an opportunity to be part of this educative webinar. Next. As we know that the neurotube defect are serious malformation of the central nervous system when the neurotube fails to close completely in early embryonic development. Common forms include spina bifida, encephaly, and encephalocele. Globally, neurotube defect contribute to acceleration to prenatal mortality, stillbirth, and early neonatal death, lifelong disability, and health system burden. Preventing both primary and secondary is considered one of the most cost-effective intervention in maternal and child. That's the great job being done by NIHR with Professor Hudson and the colleagues, that the prevention is less costly than the treatment of the neurotube defect. Next. In Tanzania, facility-based studies have estimated the birth prevalence of structural birth defect, including neurotube defect, at around 9.9 per 1,000 live births in urban Dar es Salaam hospital in 2011 to 2012. Prevalence of neurotube defect and uptake of the folic acid program in antenatal clinic in Tanzania, a system review 2023, Journal of Africa Neonatology. Next. What perception in the community has been introduced? I'm the program coordinator of neuroscience nursing in Tanzania. We have the pioneers, 5 pioneers of neuroscience nursing. We normally have the discussion with the community, but this is one of the community meeting with the PNNT team in Tanzania. Next. The community perception, we have the low awareness. Many communities are unaware of the neurotube defect causes and prevention strategies. And we also have the cultural belief. They believe that neurotube defects are often attributed to spiritual causes and constructural punishment. Also, the stigma, families may hide affected child due to shame or fear of discrimination. And healthcare mistrust. Some communities distrust medical explanation and prefer traditional remedies. As I'm speaking right now, I'm in Dubai in the conference. You see, this is a real global burden. We had the presentation from the South Africa pediatric neurosurgeons. So we really need to create awareness because this is really a global burden. Next. We sometimes have the meeting with the mothers from pediatric neuro unit. Like you see the photo, I'm discussing some issues with the mothers to see what is their perception regarding the neurotube defect. Next. On the discussion, you have some of the mothers, as you can see, I have noted, they mentioned that they have noted my self-pregnancy at 3 months, then I started in my antenatal clinic. So you see, the time they noted themselves that their pregnancy, even the preventive measures, they won't be effective as they could have the prenatal clinic visit. And another mother mentioned that I have never heard about this thing in my family. This is the first problem. So my family, a father of my child, and have had to go with that man to. So the problem should not come to the parent side. So when a female gives birth, one of the mother was admitted in hospital for almost 6 months, no family visit, because they thought that the problem come from the husband's side. So she should follow the husband and not come back to the clinic. And unfortunately, the husband hit the lady and left the lady in hospital. No one is supporting from both parents and the husband side, which is terrible. Again, another man said that I wish I could get information on how to prevent hydrocephalus. I could do that. In my village, we don't have educational programs in school. So I finished my grade 7 and I got married, and this is my first child, and my husband left me. So in some of the village in Tanzania, the awareness program, they have never heard on that. So when they don't have the prenatal clinic, and still the stigma, once you have the neurotube defect child, the community isolate you. So most of the mothers with the affected child remain in hospital sometimes 1 year, more than 1 year. So unless you have the good Samaritan who can keep them in their house and support them in their living expenses. Next. So another mother say, I was in class, I didn't know if I'm pregnant until my teacher called my parents. When they asked me, I told them I had sex, one with my uncle, but he told me I should not mention or say to anyone. My parents were mad on me, and my uncle ran away. Until now, no one is caring about me and my child. So this mother also have been in hospital for 9 months with the support from other mothers and the community and hospital treating the child. So this is terrible. So stigma is still a problem. Another mother say, I have never heard about preconception clinic visit. So I have become pregnant without any prevention of abnormalities to my baby. So I give birth to baby with spinal bifida and hydrocephalus, and my husband left me in hospital and never pick up my phone. Even family member from my husband are never calling me. So the husband took that lady with the child in hospital. When they saw that is a process treatment, is not a one-time treatment, so the husband left the woman in hospital and then never come back again. That is terrible also. Next. So another woman say that this is my third child. I visited clinic at 6 months of pregnancy because my belly was too big. I was asked to go in regional hospital for ultrasound test, but my husband refused. When I was due for labor, I have to go to regional hospital. When I gave birth to operation due to big head, I was referred to Moi, where I took me 3 months to get money to travel from Ruvuma to Dar es Salaam. Now my son had BP shunt but failed. He had EVD placed until infection cleared out. So those are the respondents from the 6 mothers are interviewed during the discussion. You can see how the stigma still big challenge in most of the community in the society. Next. So family members of neurosurgical patient at Moi, we had the visit with Professor Talie and Shobana from Cambridge University, And we also had the interview with the mothers, the family members admitted in our hospital. It was a great discussion, and we really have to explore a lot. So the big challenge they mentioned, like the challenges after the child gets treatment, the education was challenged for them. Sometimes the living cost was challenged for them. This really needs to be addressed. So I think prevention would be better than treating those kids after the neurotube defect problem. Next. So the key theme here are, next, delayed treatment. Family members who needed specialized intervention often treatment while they sought community support for costs related to transfer. Infection rates. Family members spoke about significant and repeated infection to surgical site, and the CCF preventing surgical site infection would reduce the financial burden on family members. Carers education. Several family members received the instruction on how to care for their family members to prevent deterioration, example including prevention of bed sores and detecting hydrocephalus. It is unclear how extensive or effective this education was to prevent this complication. Maternal health. Neurotube defects are common, and there is limited education about why this occur and how they can be prevented. Women often present later in terms of gestation, and therefore miss the opportunity to benefit from folic acid. As I mentioned in the previous also discussion, this is challenge that most of them, they present themselves in clinic, while the folic acid can't benefit them anymore. Next. So public health response, we have folic acid supplement, promoted antenatal visit to reduce neurotube defect risk. Education campaign aim to correct and encourage early prenatal care. And folic food fortification effort to include folic acid in staple food are still ongoing. So mothers mentioned that all advertisement regarding neurotube defect prevention is better to be done, followed by entertainment advertisement such as football or drama, where majority are interested and care. When we discuss with those mothers to see how can we reach majority in terms of prevention of neurotube defect, they mentioned that sometimes they are not interested in the programs, because either the better way we can reach the majority is to use local leaders to reach the majority of the village by drama or a village advertisement. Otherwise, in the media, not majority have access to media. So challenges are limited access to supplements and screening in rural areas, inconsistent uptake of folic acid despite availability, cultural resistance to biomedical explanation and interventions, need for cultural sensitive outreach to shift perception and reduce stigma. Next. Recommendation. I think threatening the community education using local leaders and media, expand folic acid fortification and distribution, integrate neurotube defect awareness into school and church program, support family with affected children through counseling and social services. Next. Mothers are ready to be part of the educational series with their babies and give experience and encourage childbearing age group on importance of planned pregnancy. These are the quotes from the mothers I interview. Let's raise our voice to prevent neurotube defect. So, like what we are doing now here, when NIHR and Cambridge and all global team, with that effort, we can manage to reduce the burden. Thank you.